Hello, dear colleagues and students. Welcome back. Now I'm going to talk about our work um, in previous years and what we are going to do in future. First, I would like to introduce who we are. We are Shanghai Drug Addiction Treatment Center at Shanghai Mental Health Center, which is a clinical department at Shanghai Mental Health Center. Shanghai Mental Health Center is the largest mental health clinical center, and under that, we are specialty on drug addiction. Our center was established in 1997, almost 25 years. And right now, it's the only public drug rehabilitation center in Shanghai. And drug addiction is also a very main and important and main division of national clinical key specialty at our hospital. Also, we are lucky we are the key display in Shanghai, which means we play very important role in Shanghai. Our center has three main functions. One is clinical, second is teaching, and last we are also do many of research. Clinical work, including outpatient and inpatient service for all kinds of addiction disease. Teaching part, including we are the program for an MD and PhD student supervision. We also are the national training program in addiction in China during 2006 to 2011. We deliver several training program because our center is the only resource center in China. We call for the TreatNet project. TreatNet project is organized by UNODC. Right, the TreatNet's aim is to do training, to do capacity building. So we do a lot of trainings previously. Especially when the training focus on psychotherapy and psychosocial intervention training in China, because that's a very important part of drug treatment. This is a gate of our treatment center. It's a closely isolated department. This is the inpatient parts. We have 20 beds. This is our staff. We have nurses, social work. We have doctors, very young and active team, luckily. So for the research part, in previous years, our group did a lot of research. These slides list some of our clinical study on psychological therapy intervention. So we do a lot of clinical trials on all kinds of psychological intervention, including relapse prevention training, for the heroin addicts, We also developed some CET focused on plus biofeedback intervention. So this aim to reduce craving for heroin dependence. Also, we are doing a clinical trial on contingency management. So this is carried out in methadone clinics. So it should the contingency management can improve retention rates for methadone maintenance patients. Also, we do some psychosocial intervention in community and CBT in MMT clinics. All research showed that it have positive impact on the outcomes of the clinical outcomes. All these clinical trials are published in international journals. The second one, we do some clinical study on drug dependence in China. So based on our NIH project in 2001. So we found that the polyol drug use patterns and have a negative impact on relapse among heroin-dependent patients in Shanghai. Also, we found that predictors of heroin use can predict the relapse of heroin-dependent patients. We can find heroin-dependent have different outcomes. So some patients have a high relapse rate. So this gives us some idea how to prevent relapse based on this result. Also, some other drug use, such as alcohol and opium use, have impact on the methamphetamine-dependent patients' recovery predictors. So this is very important for us to understand why some people with drug dependence will relapse. What's the factor related to that? What we will do to prevent that in future. This is an ongoing study. We call that the CARDI study. As I told in the first part, right now, methamphetamine or MI user disorder is the most popular addicted patients in China. So we, with the support of a national research project in China, we established a big data and a big clinical cohort study. So the study called CAR study. We follow up MI use disorder and the occasion users and the controls and to see if they are dependent or if they are relapse. So the purpose of this project is to establish large-scale clinical data and biological sample bank and find objective and biomarkers for early detection, diagnosis, and relapse prevention. Also, based on that, we hope can develop some new interventions for MI dependence. This is the whole picture of this study with different subjects, we can get some different research results. This is the study the researches, and we have 23 centers right now to participate in this study. So they all connect the clinical data, biosample, and including imaging, including ERP. By the end of July this year, we have recruited more than 2,500 subjects, and the sample, the data is still increasing. We hope we can have more researches out from this study. Another ongoing study right now we are focused on is non-medical treatment. As we know, methamphetamine dependent has no medical treatment. So non-medical treatment is one of our major research areas right now. This non-medical treatment including DBS, TMS, and TDCS. TMS, RTMS, and TDCS is non-invasive treatment for DBS, but right now we didn't start it because it's needs surgical surgery. So sometimes we don't have this kind of subjects or this kind of research protocols. We need to collaborate with the surgeon to go about. So right now we mainly focus on RTMS. So the first study we do a preliminary study. We found that 5 sessions of RTMS is effective in reducing craving for MI use disorders. And right now we are exploring more complicated protocols for RTMS to find the best or the optimized protocol for RTMS. So we do have some finding that, such as we combine two stimulant models can have the best results. Also, the ITBS, another very short, quick stimulant model can improve the outcome of methamphetamine addiction. And we also do some other study to look at the psychological and cognitive impairment in MI addictions. So it is found that patients have impulsive control impairment, and so they have some decision-making problems. So this gives us some directions how to recover that. So that's why we do some other study how to revise this cognitive impairment. So we develop a computerized cognitive therapy for addiction. So this is a software. We have 5 modules and 10 tasks. All this task is focused on how to improve the cognitive impairment in MI addiction. So this is some functions we can fund the training module and the administration or management platform. We can record their activity. We can evaluate what they're doing. So this is used in compulsory treatment center, and we got the patching for that, and then we hope we can expand their use in other institutions. Another study we are most interested in is to develop some digital medicine in addiction field. We develop a community-based addiction rehabilitation electronic system. We call that CARE. We call that CARE system. So this is based on mobile phone, and so the patients can download that, social worker can use that, and doctor can use that to monitor the follow-up or monitor how their patient's going, and can deliver some service and can do some simple like psychological intervention. The care system have 4 functions, and one is rehabilitation management. So we can remind and the patients to contact with social work and to doing urine test, and it can do the evaluation, which was required by the social work. The second function is social support, and the second is crisis intervention. And when the patients go to the return to the society, to the community, there's some sometimes they experience some problems such as craving, emergency situation, and stress events. So they can seek help from the system to contact with their doctors and with the social workers, and we can get help. Last is a data platform. So this system can connect medical data, location, and they can also deliver some information, education to patients. So this is a care system we used right now. Another project we are very interested to do is use the VR, which is virtual reality skills technology in addiction rehabilitation. We developed craving evaluation and rehabilitation tool for ATS dependent patients. So we integrated we use a VR as a crew to induce craving. Then we use eye tracking and physiological monitoring, such as EEG, to record their reactions to the cues. So this integrate together as a craving assessment and help diagnosis and treatment for ITS patients. And this is still going on, especially for the therapy module. We hope to share that with you in the future. Lastly, I would like to introduce the most recently work we are doing is application of AI in psychotherapy for addiction. And so we use several new technology, including virtual digital person, natural language processing, artificial intelligence to develop an AI assessment and psychotherapy system. This is a virtual digital person to delivering psychotherapy. This we have team modules for psychotherapy. This team module is based on motivational interview and CBT, such as lecture prevention. So the AI person can automatically interface with the patients to deliver the psychotherapy. Right now we are doing the clinical trials, and we hope to share that with you in future. Right now, in the rehabilitation center, or we studied technology is used there. This is for the VR, and this is some rehabilitation activities. We are doing some mindfulness and some groups. So we are very happy to help the compulsory treatment center to enrich their daily treatment and rehabilitation activities, which is very resourceful for us. Another work I would like to introduce, but not is for, as I mentioned earlier, I'm the ICD-11. I was involved in ICD-11 work, so we already did the reliability and the utility study on substance and addictive behavior disorder, especially on some gaming disorders. So we are part of that, and we did the study in China, and we developed a screening tool for gaming disorder based on ICD-11. Also, the study showed that the ICD-11 criteria is useful and acceptable in China, and we also give some recommendations to WHO to revise the ICD-11 guidelines for substance use and addictive behavior disorder. Lastly, I would like to mention some work during the COVID-19. Maybe it is helpful for you to share that with your colleagues. So during the COVID-19, because COVID-19 is a very stressful events, so stress is related to addictive behaviors. So we do a lot of education, psychological education to prevent, to teach them skills to prevent substance use. And we also involved in some international collaborations on the COVID-19 impact on our clinical work, organized by ISOM, and also another project organized by WHO. So this is, I think, is very important during this special time. And also we do some research during the COVID-19, and such as we published a paper. We write a commentary to mention that challenges of methadone clinical maintenance treatment during COVID-19. Also, we read our draft our clinical. We do some guidelines how to prevent and face the challenges for drug-dependent patients, how to meet their the treatment needs and decrease the negative impact of COVID-19 Also, okay, so this is what we are doing, and futures, and well, I think there's a lot of challenges, and there's a lot of things we need to do in future. First, we know the problem of drug abuse in China is still very serious, and lack of effective treatment, and lack of shortage of capacity building, human resources. So the relapse rates is still very high. And addiction should be addressed as a public health problem, and prevention is very important because when dependent, it is hard to get recovery, and we need take comprehensive treatment and rehabilitation philosophy for the addiction. And so we need a lot of work to do, and professional capability is very critical to improve drug treatment and rehabilitation in China. Also, because there's a many system or institution involved in the drug abuse treatment and relationship. So collaboration among these related institutions is very important. Lastly, the addiction medicine should be strengthened, and we need to do more research to improve treatment and rehabilitation outcomes. This is the textbook we read. I'm the chief editor, one of the chief editor of this book. So that's all I would like to share with you. I look forward to working with you in future. Thank you very much for your attention. Thank you. That's all. Bye bye.